how do we know that the brain has recovered enough to go back to play?
So because we don't have a good way to diagnose concussions, meaning an MRI scan or a CT scan show us good pictures of the brain, but they don't show us the function of the brain or if the cells are giving the energy to the brain. Now, we're trying to find some tests that might be able to do that in the future, but nothing right now is doing a good job of it. So that makes it a little bit tricky because we have to rely on athletes to tell us that they're having symptoms. That's really, a big part of the concussion is the symptoms that go along with it. So that makes it a little bit tricky because athletes want to get back to play, and so they can tell you that they're feeling back to normal even if they might be having some symptoms. And so that's caused a problem in treating concussions and saying, well, how do we know that they really aren't having symptoms, and how do we know it's safe to put them back? So what we've done is come up with some tests that we can give the patients. These tests are usually done on a computer. We call them neurocognitive tests, and they're testing the brain function. So typically it's reaction time, ability to make decisions, and how quickly we can make decisions and how accurately, and memory. And we're testing those areas because those are commonly disrupted. That's part of the thing that's disrupted when these cells are not functioning properly. It usually affects these pathways. So we use a test that we give before the season starts, what we call a baseline test, and then we know where the brain is at baseline. So once they have a concussion and their symptoms, they tell me their symptoms have gone away, we can give them a post-test to make sure that they're back to their baseline level on that test. So it's a safeguard. It's not a diagnostic test. It doesn't tell me yes or no they had a concussion, but it does tell me if their brain in those areas that are usually affected by concussion are back to normal. And if they are, once they pass that test, and once we do our physical exam that sometimes shows up things like balance or coordination or tenderness in their neck, things like that sometimes show up with concussion too. Once those have cleared out, then we assume that it's safe to begin a return to play progression where we start putting stress on the brain a little bit more each day for 5 or 6 days until we can say yes. Once we've done that, then we think we've done everything we can do to make sure that brain's back and ready to go back to contact.
All right, thank you.